Hello friend, welcome to the channel Pharmacy Dictionary. We have completed a section A of your B Pharmacy 4th semester Pharmacology 1. Now we are going to start the section B, and under the section B there are so many important topics, and out of which the most important topic is Pharmacokinetic. So in this whiteboard section we are going to study about the Pharmacokinetic and their basic overview. This topic is one of the most important yet very simplest topic, but you need to focus your concentration on today's lecture, because I have not included much theory point of view. I have included many of the important diagrams which will clear your concept regarding pharmacokinetic as well as somehow pharmacodynamic too. So first of all, we have to understand what is the meaning of pharmacokinetic. As you know the definition of pharmacokinetic, it is kind of fill in the blanks. Where it has to be filled, there is a simple sentence, or we can say skeletal of the definition, that is what does blank do to the blank. So we have to fill two words, either drug or body respectively in this two field, then we will have our consecutive meaningful word, that is pharmacokinetic. So in case of pharmacokinetic, we will place body in the place of first filling the blanks and the drug at the last. So what will be the definition? The definition is what does body do to the drug which has been taken by yourself. Now let me clear you this paragraph, this definition first. So there are so many medicine, like if you are talking about the oral route of drug administration. So under the oral route of drug administration, we can give few doses form like solid, liquid or somehow semi-solid. But in case of other route of drug administration, we may give drug accordingly. Like in case of parenteral or IV, only injection, that is already in the solution form, can be given through. So if you are talking about the route of drug administration, it is very important in the pharmacokinetic profile. But let me give you the example of oral route of drug administration so that you will understand the concept easily. So in case of what does body do to the drug, suppose I am taking any of the drug. This is a medicament, I am taking this medicament. So what is going to happen with this medicament? See, whenever we take medicine, that medicine goes through our stomach. If we are talking about the oral route of drug administration, after reaching to the stomach, there are so many body fluid present in there, present in stomach. Along with body fluid, there may be a food particles and there may be other substance to which you have been taken as a part of your meal. So whenever this drug will reach to the stomach will do something with that. What will be it do? They will start disintegration, dissolution of the particular respected tablet or capsule or any other suitable dosage form. If it is in tablet, if it is in solid dosage form, then the disintegration and dissolution will be applicable. But if you are taking the syrup or any other liquid dosage form, the disintegration and dissolution is not applicable for that dosage form only. So in this case of pharmacokinetic parameter, there is a study of ADME. Now what is the meaning of this abbreviated word ADME? This is one of the most important questions generally asked in semester examination. So respectively, ADME stand for absorption, that is AB. You have to focus on this word AB because there is another word called adsorption which is different from this kind of phenomena. So absorption, then apart from absorption there is another phenomena of ADME. These are distribution, metabolism or also known as a biotransformation, and finally excretion of the drug from your body. Now let me clear the life cycle. If we are talking about the life cycle, what are the starting process, what are the intermediate step, and what will be the elimination phase? So we can say this is in a one word that in pharmacokinetic we study about the movement of drug into, that means into the body. Within the body, it's one from one part to another part, and out of the body, that is its elimination. So complete study about their introduction, their movement within the body, and finally their elimination or excretion from the body can be considered as a ADME. Now let me assume a condition. Can we see the inside phenomena of our body? Can we see what is going to be happen with the drug from the body, by the body? No, it is not technically possible. So we have to do a situation, we have to create a dummy situation mimicking the situation which will clear our concept. To make you better understand, I am going to do some practicals. So as you have seen, there is a beaker with water in my hand. So assume that I am going to place this kind of drugs, any of this drug in this beaker. So we have to assume that this is not a beaker, this is the stomach, and the water present inside this beaker is not actually water. You have to imagine as a body fluid without presence of any food, but there is chances of presence of food too. But in this demonstration I am not going to include any food liquid particle or any solid particle. So what I'm going to do is that I'm going to place this tablet. This is an example of tablet. This is a crocin tablet, crocin fast relief tablet, or any kind of tablet you can consider it. So this is going to be taken by myself via oral route of drug administration. While taking this oral route of administration, this is solid dosage form, so it has to go for disintegration and dissolution respectively in prescribed manner of time, depending upon the tablet to tablet. Is it film coating, it is sugar coating, it is an anti coating, it is an uncoated tablet, is a fast disintegrating tablet or normal tablet, or having fast relief tablet. It may be variable according to tablet, but this is general tablet. So after taking via oral route of drug administration, this will finally reach to my stomach. And what is going to happen with the tablet, as you can see in this demonstration process. I will upload another separate video which will increase the visibility of process inside the beaker so that you will understand, but I am sure that it is also visible to you. As you can see, the tablet goes for disintegration. That means now tablet is going to separate into small particles, as you can see that after some time, but I do not have that much time to show you that condition. After some time, this disintegration will be converted into dissolution. That means completely disappearance of the particular tablet in stomach with the fluid present in the stomach. That's called dissolution. So let me give you another example. I have few tablets and I'm going to place these tablets too. So as you can see, the tablet initially it was looking like a solid masses, nothing was happening with them, but just after some time this tablet has become disintegrated and finally it will be dissoluted also. So this process is very important for the action of drug. But do you know this process is happening inside the body? So body is going to disintegrate, then dissolve this particular solid dosage form. So who is dissolving the drug? Body. Who is performing absorption afterwards? This body. So what is the definition of pharmacokinetic? What does body do to the drug? So this body fluid dissolves the drug, then only drug will be able to produce its effect, and that will be considered under pharmacodynamic, not pharmacokinetic. So in this pharmacokinetic, obviously you can see absorption, distribution, metabolism and elimination or excretion will be take place. If you are talking about the pharmacokinetic, so it can be applicable with all kind of drugs like solid dosage form. All these are example of solid dosage form. This is tablet, uncoated tablet. This is coated tablet. These are the capsule, and the capsule are of two type also. One is a hard gelatin capsule having body and cap, and the another one is a soft gelatin capsule. Only liquid can be filled under the soft gelatin capsule. There is no body and cap in part of this soft gelatin capsule. So all this solid dosage form or oral route of drug administration able to give the drug can go through this disintegration and dissolution. So the process is now begin. Now we have to understand the each word ADME first. What is the absorption? Absorption is a process of moving of the drug molecule from site of administration toward the systemic, that means toward the blood. That's called absorption. Whenever the drug via any route of drug administration reach to the blood, dissolve in the blood, finally we can say it's called absorption, because here blood is going to absorb the drug. Who is going to absorb? Let me ask a question from you. Which part of our body going to absorb the drug? Only blood. So blood and other fluid also. So blood or any component of our body is absorbing the drug. So who is absorbing? Our body or any part of our body. So this is called absorption. What does body? Body is absorbing that drug. So first, what is absorption? I think you have clear with this word. Now second, what is distribution? What is the meaning of distribution? As in this case, as you can see, the drug remain on the same places, and the concentration, I am not sure about it because I have to go for the analytic purpose. So the concentration of drug is higher at this site where it is disintegrated yet not dissolved completely. It is not dissolved completely. I need to stir it, I need to shake it, and I have to give this situation as a stomach, as like we have used to jump in from one part to another part. So after some time, this drug from higher concentration move to the lower concentration, that is called diffusion, or we can say distribution in this case of biological phenomena. So the drug has to be moved from one part to the another part of our body, or we can say from the site of absorption to the blood, and from one part of the blood to the site of action where the drug has to perform its action. Then this process is called as a distribution. Suppose let me give you an example. I have 100 of chocolates and I have to give this chocolate to all the students. So what I will do, I have lots of chocolate. I cannot eat all those chocolate with me alone. I cannot eat that. So I have to distribute. So I will give each student one chocolate, one chocolate, one chocolate. What will happen if I give 50 chocolate to one student and the 50 student will not be able to receive any of the chocolate? Is it fair? No, no. The same principle is applicable with the drug. So we have to equilibrium distribute the drug throughout the body, so that each and every part of our body, depending upon the profile of drug, either it is lipid soluble or water soluble, so that it may cause different types of barrier. So it is important phenomena. That is second word, distribution. And the third one is metabolism. It is also considered or also known as a biotransformation, and I have to explain this word bio and transformation. That means one form conversion into another form. Whenever drug molecule or substance converted from one form to the another form is called transformation. And this process of transformation in taking place in the biological organism, that is why it is called biotransformation. And as an overall average definition of this metabolism, it says conversion of complex molecule to the simplex molecule. But in case of pharmacology, there are so many consequences of metabolism, and we will see this all consequence one by one in upcoming lectures. So let me give you the name of only consequence. Conversion of drug from its active form to inactive form, conversion of drug from its inactive form to active form, conversion of toxic material or poisonous material into less toxic material, conversion of lipid soluble drug into water soluble drug, and so on like this. So these are basic consequences of metabolism. Then only drug will be able to produce its action. So there are some drugs which can destroyed by the process of metabolism. This is called first pass metabolism, and this process of first pass metabolism is only applicable with the oral route of drug administration. So if you want to overcome the unwanted effect of first pass metabolism, we have to go for the another route of drug administration apart from the oral route of drug administration, like IV, IM, SC, topical, sublingual, buccal, rectal, vaginal, etc., etc. I have explained all this point in route of drug administration very deeply and precisely. So you have to watch that video if you want to clear your concept regarding route of drug administration. And then finally, the last process is out of the body, that is excretion of the drug. In most of the case, people give weightage for the ADM, not to E. But as per my personal opinion, E, that means excretion, is very much important. I cannot say that which one is very important, which is not important, but as per my personal opinion, excretion is more important, because it is not required to give any drug its effect, but it is very important that it should not produce any unwanted effect. So in case of elimination, whatever the metabolites, after the process of metabolism, the remaining molecule is considered as a metabolite. So if the metabolite is of no use now, it has given its pharmacological action, then it has to move out from our body by a different route of drug elimination, as I have explained in this diagram. So it is very important that drug should get eliminated from body after producing its desirable or somehow undesirable effect. Otherwise, the drug will be accumulated in our body, accumulated in a body fluid, accumulated in the body tissue, and that may convert it into a problematic situation. Like it may convert it into a toxic metabolites, and that can be deposited inside the kidney, that may convert into a kidney stone or other problematic kidney situation. If it will deposit deposit in the fat, that may be converted into accumulation effect, and that will prolong the duration of action of that particular drug and increase the chances of toxicity. So there are so many complications related or associated with the excretion or elimination of the drug. These two terms are so different, excretion and elimination. I will explain this whenever the time will come for this topic. I will explain you very clearly about the difference between excretion and elimination. So this was a theory process. I have shown you the demonstration only. Now let me explain this whole process with the help of representative diagram. You will not find this diagram in any of the book, because this diagram is made by Solution Pharmacy as well as Pharmacy Dictionary, at least by myself. So it is very important to focus your concentration on this diagram. And if in your exam the question asks what is the pharmacokinetic and write short note of pharmacokinetic, then you have to explain this process. In pharmacokinetic, we have to study about the process of movement of drug from cell membrane or across the cell membrane, like active diffusion, active process of movement, passive movement, facilitated movement, pinocytosis, endocytosis, phagocytosis, all these parameters. We have also to study about the bioavailability and so many other factors which can affect the action or mechanism of drug, and all have to be studied under the parameter of pharmacokinetic, and we will see one by one all these points. So let's start the presentation with the diagram. So whenever we take any drug, here I am expecting the route of drug administration is oral route, because this will be clear one route at one time. So once a drug is taken by any of the person with oral route of drug administration, that drug reaches to the stomach. So this drug which you are taking is now reached to the body, that means stomach. In the stomach there are many things are present, like water or different types of fluid which you have taken, food which you have taken. So there is chances of affection of the drug by the food or water present. That will be a next part in our topics. So they may affect the action of drug. Let it be, leave it right now. Let's concentrate the process of pharmacokinetic first. So this drug will reach the stomach. Then after this will start disintegration and dissolution, as you have seen in the demonstration. So this drug will be disintegrated into small particles. This is called disintegration. After a particular time, this disintegrated or broken down particle will completely dissolve in the body fluid, and that is the actual process of dissolution. Then only the drug will be moved through the small intestine along with different constituents. So this drug will start moving toward the small intestine, and you know it very well, or we will have to see about this process, that the maximum of drug absorption is take place only in the small intestine. So from small intestine, different process of absorption, or we can say movement of drug across the cell membrane, like I have explained you, like active, passive, cell mediated, exocytosis, endocytosis, pinocytosis, phagocytosis. There are so many processes by which a drug molecule moves from the small intestine toward the bloodstream. So once this reaches into the blood, then only it will be able to produce its desirable or somehow undesirable, which is associated, which is not under your control. So it will start its pharmacological effect. But before that, if you are talking about the oral route of drug administration, it will go for the first pass metabolism via the portal vein. So after reaching the portal vein, they will get metabolized, and somehow some drug will be reached to the blood with different mechanism. And that is a part of metabolism. So this drug will be reached to the portal vein, there will be reached into the liver, and in liver the drug will be get metabolism. So first step is, what is that? This is the absorption of drug molecule from small intestine to the blood vessel. This is the first step of ADME of pharmacokinetic, that stands for absorption. I again request you to focus on the second word, that is B, not D. So this is first step, absorption. After distribution, the drug will move from one part or one section of blood towards the whole body, so that it will be produce its desirable effect. The movement process is considered as a distribution. As you can see in this diagram, if I have something in a large quantity and I have to balance the quantity, then I should distribute or equally distribute to all the participants or all the members available in my family. Or if you're talking about the case of the body, then each body tissue component has to receive the drug according to their profile or according to their nature. So this distribution will take place with the help of different body fluid like blood and other constituents, so that the drug will be equilibrium distributed. After distribution, there will be a equilibrium metabolism. In metabolism, the drug converted from one form to the another form. One complex molecule converted into a simplex molecule. One active form may be converted into inactive. One inactive, that like a prodrug like levodopa, carbidopa, may be converted into an active form like dopamine. So this process can be happen. Most toxic drug can be converted into less toxic drug due to enzyme induction or inhibition process, process, and the vice versa dangerous effect can also be achieved through the metabolism with a specific drug. There are so many parameters of metabolism, and we will see this in upcoming lecture. So after metabolism, the final step of the drug that is called out of the body is excretion. What is the excretion process? Excretion means removing out the particles of drug either after their action, or in some cases drug may excrete it without giving its pharmacological action too. So most of the cases drug will produce its action, then only after that will get out, eliminated from the body. So there are so many routes of drug elimination from which the drug may be eliminated, like urine. And in case of urine, it is an important parameter. The drug should be of water soluble. Only water soluble drug can get excreted with the help of urine, or we can say via the kidney. So in case of excretion, major route of excretions elimination are either urine or stool. Lipid soluble drug or water not soluble, not non-water soluble drug can be eliminated through the stool. So in this case of urine formation, you know it very well that this process is called urine formation. So blood will come through different parts of your body, and the drug will also come along with the blood, so that it may get filtered and may eliminated with the help of urine. So suppose this drug is coming with the help of blood. After reaching to the glomerular filtration, they will filtrate. The steps of urine formation consist of 3 steps. First is filtration, then secretion, then reabsorption, which you are not going to study in this process in this video. So after this step, the drug will be eliminated or excreted with the help of urine, with the process of urine filtration process, urine formation process. So in the second phase, the drug may pass out through the rectal route via stool, via different types of food material which you have taken, and the other route of elimination are sputum. We can eliminate the cough. The other was tear, milk, saliva, sweat, sperm, and different other which are not included in this whiteboard section. So these are minor route of drug elimination, specific route of drug elimination. Now we have to see different types of barrier, like intestinal barrier, epithelium barrier, cell membrane, renal membrane barrier, capillary barrier. These are the barrier. What is the meaning of barrier? This is not a part of today's video, but I will explain you later on. Barrier means a hurdle which can stop the movement of drug from one part or one section of the body to the next part or next section of the body. So these are basically barrier: intestinal barrier, epithelium, cell membrane, renal membrane barrier. And the most important barriers are triple B responsing. That is called blood-brain barrier, which is the barrier between blood and brain. So it will restrict the movement of drug from blood to the brain specifically. Only highly lipid soluble drug can move through this. Same blood placental barrier, B stand for blood placental barrier, and the last one is BTB stand for blood testis barrier. So this barrier will restrict the movement of drug from the blood to a respected part. In all this word BB is common, that means called blood and to respective part. So coming to the next, that is very important. There is a note we can say this movement is affected by its water solubility or lipid solubility of the drug. If the drug is water soluble, then it may move from the small parts or like cell membrane. But if you want to move the drug from blood towards the brain, the drug has to be highly lipid soluble. Only a lipid and highly lipid soluble drug can cross blood-brain barrier and blood placental barrier, blood testis barrier too. So that is why the reason that in case of pregnancy, the drug can move from placenta, move from mother to fetus via placenta if the drug is lipid soluble. So friend, that's all for today. Expecting that you have got the all point very clearly. Thank you very much for watching this video. The reference for today's topic is KD Tripathi 8th edition, and all of the points are derived by myself. So please give us your feedback in comment box, and thank you very much again for watching this video. If you want to take the screenshot of this lecture, you may have after some time. Thank you.